Hi, y'all. Kelly from Broken Carnivore. Welcome to the channel. A couple months ago, I did a video about Carnivore healed everything in my body except for this one thing. And I did a follow up video after that, and it was about my right hip. Many of y'all that follow me know that I walk with a limp, and some of y'all asked about if I was going to have something done about it or have it looked at because it's not going to get any better. So I decided to get my finances fixed to where I can be able to do this. So if I had to take off because of a surgery, I can be able to use my short term disability at work and be able to pay my bills. So I went to my primary care physician, and he ordered another X-ray because the last one showed severe arthritis, and which this one they said it shows, but you're not going to get an accuracy with an X-ray. So he referred me to a orthopedic specialist in Moberly, Missouri. His name is Dr. John Vanny. I really like him. Matter of fact, I know somebody that I go to church with, go to men's group with, that had hip replacement, and he was very good. And he actually has type 2 diabetes. And so I met with him on December 4th. And so what he was telling me about that they say no, it's severe arthritis, but he said it looked something different, like more what they call a vascular necrosis. We will look that up, and I will explain what it is through Google. So as a go, he wanted me help, he wanted to see what my range of motion is, which I didn't have very much range of motion. I don't have very much range of motion at all on this right hip. I have more external, but when it comes to internal rotation, I don't have it at all. It's tough. Like on my left side, I have no problem. I can cut my toenails. I can put my socks on, no problem. I can actually tie my shoes. I can touch the ground on that side. On the right side, there's nothing. And there's no way nothing can better. No matter how much stretching I did, no matter how much momentum or mobility exercises, physical therapy, there was no way that I can be able to get it done. And so to be able to get this accurate diagnosis, we needed to do an MRI. So he scheduled an MRI. I just had that MRI done on December 15th. And within 2 hours, I got the results, and it did not look good. Even the MRI tech that I got to meet, and he knew my brother back in the 90s, 80s, and 90s. He said, "Did you ever had an injury on the hip?" And I'm like, the only thing I can think of is I fell on ice twice in the same spot at work. But every time I got up, it seemed like I was okay. But here I'm going to show you my test results. So we're gonna flip over here, and we're going to click on this through my patient portal, and here we go. I had an MRI procedure done for the pelvis and sacrum area because the clinical indications was kind of diagnosed as a vascular necrosis of the bone of the right hip. We had to do it. To be able to do it is an MRI. That's the only way we're going to get that. So the MRI found the imaging found of the pelvis. If the pelvis was performed without IV contrast, I don't know about that. I am not medical. I don't know nothing about that. So they did an examination of the central aspect of the pelvis, shows no pelvic ascendus. I'm not for sure how that's pronounced. I'm medical. I'm not very good at pronouncing words, but we're going to look that up to what that means. There was no significant endopathy. We're going to look at that word. There is no effusion of the right or left SI joint, which that's good because that is also part of your hip region, and that helps with your flexibility to be able to bend down, tie your shoes, to be able to touch your toes, do everything, squats and everything. You got to have that. So there's no effusion of that, and we're going to look that word up. They did find a very mild osteophyte formation of the lateral aspect of the left femoral head, representing mild degenerative changes of the left hip. which I don't have no issues with the left hip. So I'm not going to worry about it. I feel that being on this carnivore diet that kind of helped and stop any of that. But here is what they found, and this is why the carnivore diet did not heal this part of it. There is prominent osteophyte formation of the right femoral head with joint spacing narrowing the hip joint, representing severe degenerative changes. There is also flattening of the femoral head, as well as increased signal in the inversion recovery images and decreased signal of the T1 weighted images of the superlateral aspect of the femoral head. This likely finding of a vascular necrosis with collapse of the femoral head. There is some increased signal of inversion recovery images, more central aspect of the femoral head and medial aspect of the femoral neck, which likely reacted changes to the pathology involved the femoral head. There's also small right hip effusion. So there is the result. There is damage. There is something definitely wrong. This is what's causing me to have that leg discrepancy because, and the non mobility of the flexibility and the full range of motion on that side. So, most likely, it's going to be a hip replacement. I do get to meet with this specialist, Dr. John Vanny, on the 13th of January to know what we're going to do. My goal is hoping that we can get this scheduled within by the 1st of February because spring is, we're within 90 days of spring. Tomorrow, December 21st, this video will be out before that or after that, but we are approaching into the winter season, and in 90 days is spring. Not only that I have this channel, I also have a channel called Show Me Homesteader where I am building a homestead farm on a budget, and as spring comes, I want to get this taken care of. So when it comes to around late March, April, by May, I want to be able to get what I need done. I want to get back to doing what I've been doing. So I like to get this done sooner. I know many of y'all had commented like, you don't want the surgery. Sure, mind over body. On this situation, there, carnivore is not going to heal. It's not going to grow back bone. It's been damaged. There's nothing I can do about it. And I can't live with this the rest of my life. And it is an aggravation, when you have to rely on, people to cut your toenails or tie your shoe or pull your pant leg down over your boot. It gets a little old. And I am one of those independents, and I'm one of these that go, 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 go. And when you have to stop and you sit for a little bit and you have to take a break to ease that, like, I don't have no pain, but there is my very mild discomfort. It is hard to walk a lot of times, and I got to be able to have my full range of motion back. So the only option is surgery, hip replacement, because the hip is shot. And no matter what, I mean, there's two kinds of surgeries they do: either total hip replacement or what they call hip resurfacing. Hip resurfacing is a longer one, and they usually do that for people that's under the age of 60. But with this, and with probably even into the neck part of it, we're going to have to do a total replacement, which that's why I'm hoping that will happen. And no matter what, it will be okay. I'd rather have a new hip and be able to have most of my full range of motion back and be able to do my job and be able to do what I want to do and be able to get out there in the future. Because, there's things I want to do. I did a video on my first hike and I went halfway through, and of course, that hip affected me. And this is before I even put the lift in. It affected me, and I had to get a ride back to my truck no matter what. And so I'm not going to give up. That's what I want to do. There's things I want to do. I don't want to deal with this the rest of my life. And as I get older, you know, would it even be more wear and tear? So, as I looked, as we go, I want to research these other words. What is a vascular necrosis? So we're gonna go over here. Oops, I need to put this down. We're gonna go share this tab. So we're gonna ask Google, what is a vascular necrosis? A vascular necrosis, AVN, or osteocinosis is bone tissue death from the lack of blood supply, often affecting hips, knees, and shoulders, leading to pain and potential joint collapse, commonly caused by injury or long term steroid use or heavy alcohol use, with treatments ranging from limiting activity to surgery. Note of course, note from the Medical Medicine Plus, Mayo Clinic, and Cleveland Clinic. Um, so let me get back over here. So, what could have caused this to have this? Well, I noticed this issue way before I started keto. When I discovered Dr. Berry in 2021, I was on not only on the standard diet, but I also had at this time around 2017, I had a short period of time where I chewed. I chewed tobacco, and I'm talking about like um, Copenhagen, Stoker's, that kind snuff that you put in your mouth. And I wasn't just a light chewer; I was a heavy chewer. This not only affected, this is probably what started it, but it also affected me at that time period of erectile dysfunction. And why did nicotine, they say, oh, nicotine is supposed to be good. No, it's not. It is a plant toxin. And if anybody is chewing or smoking, they need to consider to quit, because I am a living example. I am very grateful that I am able to do this video. I'm very grateful that I have my mouth. I didn't have cancer or anything like that, or develop cancer, or have any other issues. Well, I feel that this is where it started, because this is what caused me to have high blood pressure. This is caused the erectile dysfunction, and I'm very grateful that it reversed. And also, I say this is what caused it. So we're going to go back to Google, because I had researched it to do it, and we're going to see what it says about nicotine, because nicotine does cause the narrowing of the blood vessels. And so we're going to go back to Google, and we're going to type. And here we go. And it says, yes, nicotine is a major risk factor for a vascular necrosis, also called osteoporosis, because of the constrict blood vessels, reducing blood flow and oxygen and nutrients to the bone, especially the hip femoral head, leading to bone cell death and collapse, with studies showing smokers have significantly higher risk. Well, the one thing about it is, the one thing is with this, it is bad. Chewing is worse than smoking. And this is the reason why I'm saying this, because I'm a primary example. An average size dip of chew like Copenhagen, Stoker's, or Grizzly is equivalent of 4 cigarettes. You absorb it right straight through your skin. Just remember, when you put on, chemical lotions, or you use soaps, body washes, and shampoos, remember that absorbs right through your skin. It's a direct contact. And nicotine is one of those plant toxins, especially into tobacco plant, that causes the narrowing and hardening of blood vessels. And that's including, yes, to your genitals. And not only that, it just said there to your bones. So that's probably what the start. I wasn't a light chewer. I was heavy. I went a can a day. I'd get the Stoker's brand and I would get the whole big $13 big can where you have one little can, and I would go through that a week. I'm very grateful, and I should have had indications to quit when my right side of my inner gums, between my gums and my mouth, was raw. That's indicated that that's not good. And that's what caused the blood pressure. That's what caused this. And I'm very grateful things are reversed when you quit because your body will heal from that. So let's go look at we're going to look at the other effusion and endopathy, and then I will explain to you as I wrap this video up, what did Carnivore heal on me. So we're going to go back. We're going to type in effusion. Well, there you go. Effusion means escape of fluid, either a physical outpouring from vessels like blood or pus, or even commonly abnormal fluid buildup activity like water in lungs, or pleural effusion like or in the knee due to various issues like infections or injuries, often causing swelling and pain. Let's look at the other one, endopathy. Not that word. I don't know what the heck I typed there. Endopathy or lymphadenopathy means swollen or enlarged lymph nodes, which are small bean-shaped immune system-like filters located throughout the body, commonly felt in the neck, armpits, or groin. It's commonly a sign of your body is fighting an infection, but can also signal inflammation, autoimmune disorders, or cancers requiring medical attention if nodes grows rapidly or persist, or accommodated by unexplained symptoms like weight loss. So there's the explanation of that. And before I started Carnivore July 26, 2024, I dealt with chronic inflammation and slowly weight gain, and especially in that right hip area. It was so inflamed. Not only that, it was affecting my left knee. I had really bad knee stiffness, and I had plantar fasciitis in my left foot because of this whole situation. But the damage was caused, the start was from chewing tobacco. What did the carnivore heal to me? Well, it took away the chronic inflammation. That's why they didn't have none of that effusion or no endopathy in there. So it healed. That part of my body healed. They had mild effusion in there, right? Because it's damaged. So, but there's no signs of that. There was no signs of a cancer. So that is a good news. So now all I have to do is get this hip fixed and replaced so I can get recovered and get back to my normal life. So there you have it. There is the results of why I have this leg discrepancy, what the cause is, and here's the results, and this is what's going to be happening. And I will update with you in the future when I have my surgery and as I recover and as we move on into the future. And I'm hoping that I have a great 2026. It's going to be even better because I'm going to be ready and go. Because as soon as this is done, there's things I want to do. I want to get my fencing built, start building fencing. I want to start having on adventures. I have some vacation I want to do. I want to get to this fall. I may not be able to get to do any other meetups, but there's one called Keto Palooza. I want to go in the fall in Louisville, Kentucky, and I want to be able to meet some of other fellow keto carnivore people out there. And I am so grateful. I'm looking forward to 2026. I just got to get through this part of it, get the finances back up to where I need to, because I know I'm going to have to pay medical bills from this. But you know what? I rather enjoy my life and have this quality life, even if I have to have a magic hip. So, like always, let's be kind, be positive, have a good attitude, and encourage and support one another. Y'all have a great day. God bless, and I'll see you on the next one.